Hello everyone, and welcome to module and week number 5. If you can believe it, we are at the halfway point. For me, I know it just feels like time is flying by, and I'm sure you guys enjoy that we are about halfway through as well. So for this week, we are focusing on 2 chapters again, chapter 11 and chapter 36. For this first video, day 1 video, I'm going to focus only on chapter 36. So chapter 36 is going to discuss on assisting with physical examinations. This is one of the key responsibilities of a medical assistant, and our roles during this procedure and this process will include things such as us preparing the examination room, interviewing the patient, documenting all of the information in the patient's medical record, positioning and draping the patient depending on the examination, assisting the physician during the examination, cleaning up the room after the visit is completed, and taking care of the instruments used during the procedure. So let's go ahead and take a closer look at what each of those categories really mean. So preparing the examination room. This will require you as the medical assistant to dispose of any used patient gowns and drapes from the previous visit, clean the examination table with the proper disinfectant, such as a bleach solution of 10 parts water to 1 part bleach, or what we use in class, the cavi wipes. It will also require you to replace the table paper if it was used or torn. You want to make sure that you dispose of any equipment used during the previous exam. So if things are reusable, you want to make sure that they are sent to the cleaning area to be disinfected properly. Or if they were a one-time use only item, you want to make sure that they get disposed of either in the biohazard, garbage, or sharps containers. You want to make sure that all the lids on the biohazard containers are closed, and if any are full, you need to remove and replace them. Next, we have interviewing the patient. So this is completed when we take a patient's health history. Excuse me. When we take a patient health history, it's broken down into 6 categories. The 6 categories are a chief complaint, present illness, past medical history, family medical history, social history, and a review of systems. Your chief complaint is the reason for the patient's visit. Why are they there that day? Their present illness contains a detailed description of their symptoms, such as the onset of the symptoms, the duration of the symptoms, and the intensity of each symptom. The past medical history is going to look at the part of the history that includes any and all diseases or medical problems that the patient has experienced in the past prior to that day. Family history is just what it sounds like. It's a record of the health problems in the patient's blood relations, people such as mom, dads, brothers, sisters, grandma, grandpa, aunts, uncles, if they're related by birth. So if your uncle who is married to your aunt, who is your blood relative, has diabetes, that does not apply to you. The social history is going to include lifestyle patterns that could affect the patient's health status. Things such as, are you a smoker? Do you consume alcohol? Do you partake in any recreational drugs? What's your occupation? What's your marital status? What's your sexual preference and how many partners have you had? What kind of diet do you have? Do you exercise at all? And what are your sleep habits? And lastly, the review of system is something that is generally performed and completed by the physician, but it's good for you as a medical assistant to know what will happen. So the physician will examine the patient from head to toe and look at all of their body systems and organs. They will use different methods to examine the patient and inspect their bodies. Those methods can be broken down into 6 categories. Either inspection, when we visually examine the exterior part of the body; palpation, which is the process of using our hands to feel the skin and underlying organs and tissues that are accessible. They will use percussion, which is when they use their fingertips to tap lightly but sharply to gain information about the position and size of an underlying body part. Accusation, which is the process of listening to the body sounds with typically a stethoscope. The measurement, which is the tool used to measure your body or specific body part. And manipulation, which is where we passively assess the range of motion of each joint that does move. Draping and positioning of our patients. So this is very important because we need to make sure that we're keeping the patient's dignity and pride in mind when they're being seen for a physical examination. This is not a very easy thing to do. Patients sometimes do become very embarrassed about having to be in certain positions, so making sure that we can keep them as comfortable as possible and as covered as possible is very important. Draping your patient is done by using sheets to keep the patient warm, and again, to keep them covered, except for the body part or body parts that we need to examine. When we position a patient, it might require us as the medical assistant to actually physically help them get into that position. And there are 11 different positions that we could be responsible for placing a patient in. The 11 are supine, dorsal recumbent, lithotomy, Fowler's, semi-Fowler's, prone, Sims, knee chest, Trendelenburg, proctologic, or sitting positions. Your book does a very great job at detailing and showing the different views of how that position will look. So please make sure that you are looking up in your book how to put your patients in those positions. And lastly, we have assisting the physician with a physical examination. Now, as a medical assistant, you will help the physician by positioning the patient and draping them like we talked about. Again, if they're an elderly or they're disabled, that may require you to put them in the correct position and potentially hold them in that position. You will be responsible for handling instruments, equipment, and other medical supplies to the provider. You will be responsible for documenting and labeling all specimens that the provider does take. You're also there to help offer reassurance and comfort to the patient. Some of these procedures that they will be doing are very uncomfortable, especially if you have a male provider and you're a female patient, which is another thing that we as medical assistants get to do. We act as a witness to behaviors of the physician and the patient. So if you have a male provider and a female patient, you will always need to be present as the female medical assistant during a female breast exam or a female pelvic exam. Now, if you have a female provider, they sometimes will not need you in the room, but they may want you in there just to help them by handing them equipment. Medical assistants also get to assist the physician by carrying out treatment plans. What that means is that we help to provide education to our patients, apply any dressings or wound changings that need to happen. We could administer medications or immunizations based off of the provider orders, or we can help them to leave the exam room or potentially even get dressed. We will also be responsible for helping schedule diagnostic tests that were ordered by the physician. Things such as x-rays, CAT scans, or CT scans could be our responsibility to help either set up or get the correct information so the patient can the procedure up. You really just, in the room with a physician, need to be the second set of hands and eyes. While they do most of the work, sometimes they just need that extra set of guidance and eyes to help them do things the correct way. All right, everyone, that is all I have for you for this wonderful day 1 video. I do encourage you to continue to read your chapter, as I try to do the best I can with these review videos, but I don't go over all of the information. So please make sure that you read your books. And as you're coming to day 1 of this week, please make sure that you have all of your vital sign equipment with you, as we will be performing some patient interviewing this week, and I want to make sure that you are prepared as we head into the week. I look forward to seeing all of you on day 1 of week 5, and happy midterm week. Bye, guys.